Hello, I'm Dr. John Perlin. I want to welcome you to the first installment of the 2021 season of A Physician's Lens, periodic conversations of importance to the physician and caregiver community across HCA Healthcare. Today, we're really privileged to have a very special guest with us, Dr. Wayne J. Riley. Dr. Riley is the president and CEO of the State University of New York Downstate in Brooklyn. And he is also the president of the New York Academy of Medicine. But we know him throughout HCA as one of our board members and the chair of our Patient Safety and Quality of Care Committee. And I would also tell you that he is a part-time resident of Nashville. His wife is on faculty at Vanderbilt University, and he also was the former president and CEO of Meharry Medical College. Welcome, Dr. Riley. Great to have you here.
Great to be here with you, Dr. Perlin.
Well, today we have a very important conversation. It's really about the importance of equity in healthcare. Over this past year, I've come to a revelation that it's not safety that's foundational, it's equity, because you can't even get to safety unless there's equity in healthcare. And I know you and I have discussed the extraordinary quote by Martin Luther King, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. What do you think that should mean to us and the physician and caregiver community?
Well, John, you picked one of my favorite quotes from Dr. King that really encapsulates how we should think about healthcare and issues that affect all our communities wherever we live, work, and play. With regard to healthcare, we now have, a greater awareness that there is not a level playing field in healthcare. And quite frankly, there's never been a level playing field in terms of how certain populations access care, the quality of the care they may receive, the training and quality of their caregiver, whether that be a physician, a nurse, or nurse practitioner. So these types of challenges that I think Dr. King's quote reminds us of is critically important for all healthcare systems and organizations like HCA, like the one I work for, the one I worked for before, because that's what we get up to do every day as healthcare professionals, and that's to serve people and hopefully make their lives better.
Well, you and I will talk momentarily about what we're doing in HCA and what we can do better. But this is intensely personal to you. As you said, it's been a part of your career, the trajectory of your professional development. But speak for a moment, if you would, about what it means to you and why you're impassioned, not only that it's a priority for you, but that it's a priority for all of us.
Well, John, like you, I'm a second-generation physician. My late father was a surgeon in inner-city New Orleans, taking care of patients who were on Medicaid, patients who had not had good quality of care during their life. And when you grow up in a household with a physician, just like you did, I know the senior Dr. Perlin was a big influence on you and your brothers, there's something that happens by osmosis when you're in the sort of the orbit of our fathers and physicians. So that was the first start of it. And then, I had the wonderful fortune to have wonderful experiences along the way like you in terms of the places I've trained. My work as a primary care general internist, which I love, taking care of patients day in and day out. And then my career kind of pivoted to one where I was in charge of educating future doctors and physician's assistants, and then it became more administrative. And then I've had the wonderful opportunity to lead 2 academic health science centers, as you mentioned. And germane to our discussion is the wonderful opportunity to have joined this board, the board of HCA, a few years back. It's a company I think that has broad impact in communities all over the country. It's a company that continuously evaluates the way it's doing things. And you and I have had discussions about sort of the approach of having continuous improvement in terms of patient care and quality, and how you, and I do credit you, Dr. Perlin, for driving a strong, effective quality agenda for HCA that I think clinicians out and in the field perceive. And to me, that is the secret sauce of why this company is so special. And it goes back to what the founder, Dr. First, said, if something to the effect that if you take care of the patient, all else will be fine. And I think that that credo, if you will, still animates the work of HCA, and I think it plays a role in why I feel so strongly about this company.
Well, of course, I share with you that pride in all of our colleagues and what's accomplished. And part of that pride is in being able to be very forthright about what's not working as well as it should. Just yesterday, New England Journal has a brand new study. You may not have seen it yet, but there was an analysis of the opioid prescribing. And obviously, putting aside the epidemic of overdosing and inappropriate utilization, it's interesting. It showed systematically across America that Black Medicare disability recipients received roughly half the dose of whites. I just received this morning a report from the Urban Institute that showed for surgical outcomes, just brand new report that everything from hematoma to post-op infection rates were higher. And these are not explainable when adjusted for all the things that one might think could confound. And in HCA Healthcare, I'm really proud that in certain areas, paternal mortality, for example, we do far better. But in other areas, we still have challenges. And what would you ask of our care providers? How should we be thinking about incorporating change into our own practice behaviors as we care for patients, as we exert our administrative responsibilities? What guidance, what advice?
Well, John, you've just sort of hit on something that is one of the unfortunate realities of our healthcare system, and we know it exists everywhere, not just at HCA hospitals, but broadly, is that certain populations still don't get the same level of care as other populations. You mentioned a couple statistics in terms of inadequate pain control of Black patients. There's many studies years ago that showed that Black patients didn't even get recommended a simple aspirin as a prevention for cardiovascular problems, that they didn't have the same level of blood pressure control as others, that their encounter sometimes with healthcare professionals and healthcare systems is less than satisfying. So that's the work that remains to be done to minimize that disparate treatment aspect of healthcare that has been well documented, well studied, and has been really made more aware over the last year and a half because of the COVID pandemic, but also because of the George Floyd murder last year. It sort of crystallized a greater awareness that all American institutions have to do some soul searching to see what can we do better in terms of social justice, health equity, advancing communities, embracing a common shared interest in improving lives. This is a moment, and I think the company has risen to the moment. More work to be done, to be sure.
Well, you mentioned George Floyd, and to me, in terms of the connection to healthcare, it made the unacceptable, intolerable, and inescapable, and it put it front and center. And I know you and I and our Chief Diversity, Equity, and Inclusion Officer, Sherry Neal, and others are working on a health equity agenda. We've ginned up a health equity council. We're now stratifying our metrics to look systematically at different communities of color, SOGI, sexual orientation, gender identity. We want to make sure that we're there for all of our patients. But let me step back a little bit. You and I are dear friends. Mm-hmm. And many of our colleagues find this an uncomfortable topic. They may actually be overly delicate, not wanting to offend somebody, but the end result is the conversations aren't happening. What advice do you have for starting a conversation and really getting at some of these issues so that we as physicians, as caregivers, don't just think academically, don't just think organizationally, but into our personal repertoire, challenge our beliefs, and really act more effectively?
Well, John, as you were, asking me that question, I got to share with you. About 2 weeks ago, I was in Minneapolis, and I went by to see. It's now called George Floyd Square, where Mr. Floyd was murdered, it's a poignant scene. And the thing that struck me, there were people from all over the world who just found themselves in Minneapolis and wanted to see where this unfortunate world event happened, if you will. But the thing that impressed me was it was a racially mixed group of tourists, if you will. I guess I was a tourist at that point. And it reminded me of the common humanity that everybody felt when they saw that event. And so I say common humanity because I think that's the way we begin to have the discussions and the listening and raising awareness about some of these issues. And they are difficult issues, you know, but you have to engage, you have to reach out with your colleagues, particularly colleagues who are not like you. And you know, I guarantee you'll find out that there's probably way more in common on many things in life between and amongst colleagues than you ever remembered. And just have a conversation, have a cup of coffee, listen, ask questions, probe, because that's the beginning of personal growth. But it also could be catalytic to organizations that care deeply about these issues that you and I have just referenced.
So building on that, let's talk about caring for the caregiver. We know that the uptake of COVID vaccines has been imperfect. We know that it's particularly low in communities of color. We know that it's lower than it should be amongst our own colleagues, healthcare workers. What would you suggest? I know you've been very active, a number of YouTube videos on trying to encourage communities of color to take the vaccination. What would you advise us to try to increase the uptake of vaccines, particularly as we see what some have characterized now as a pandemic of the unvaccinated occurring, and one that again could disproportionately affect more diverse communities?
Yeah, it's you know, I have two concerns, John. It's the diverse communities, but it's also the communities where disinformation has penetrated. Unfortunately, some of the markets where HCA operates, we've had a heavy influence of anti-vaccine sophistry, if you will. The fact of life is that we get immunizations from day one of our birth. The first 2 years of a baby's life is consumed with 6 months, 1 year, 9 months of vaccination. You're required to have vaccinations when you enroll in schools across the country. In many cases, you're required to get vaccinations when you go into the military or to college. So the fact that we now have a great series of vaccines that can prevent a very, very damaging disease to the human body, i.e. The COVID-19 vaccines, we should be, I would argue, not bashful about extolling the virtues of why these vaccines work. Now, in diverse communities, again, it ties back to what we just said. There's been this diffidence, approach avoidance on the part of vulnerable communities, particularly black communities, about the healthcare system. Acknowledge that. You cannot say it doesn't exist. Acknowledge it, but say, look, that is acknowledged, it is regrettable, but in today's world, you know, we want to protect as many vulnerable communities as possible. The vaccines are safe. They're incredibly effective after a gazillion doses have been given around the world. The side effects are manageable. And again, you know, answering the questions. A young woman asked me the other day, Dr. Riley, I'm 23 years old, I'm worried about my fertility. Will getting a COVID vaccine affect my fertility? And the data suggest absolutely not. So I allayed her concerns about that. You know, many in the black community are suspicious of how, quote, fast the vaccine was developed. But when I explained to them that it really isn't that fast, we've had this mRNA technology almost 2 decades. It was really sort of perfected towards the end of a couple of other global pandemics that we've probably forgotten about, MERS and SARS. But then it was sort of pulled off the shelf, if you will, dusted off, reconfigured, and made effective against COVID. So that's scientific progress. So I would definitely encourage all of the clinicians in the HCA network, you know, to respond to those questions and to be forceful and assertive. One of the things you and I know, John, you know, patients used to tell us, Doc, what should I do? We shouldn't be bashful about saying, I think you should consider getting the vaccine for you and your family and your loved ones.
Well, that's great advice. I know that you and I, Wayne, are bound by appreciation for what we feel are the 14 most important words in our HCA mission statement, that above all else, we are committed to the care and improvement of human life. And, when we say care and improvement of human life, it's not certain lives, it's a broadly inclusive statement. And when our intent is to be broadly inclusive, it compels us not just to look at the average, but to look at each segment of the population we have the privilege of caring for and ask some hard questions and be very reflective when we see data such as that's recently come out, be it on COVID vaccination uptake rates, whether it's on pain control or any of the other markers of the disparities. If we want to address what Dr. King identified as the most shocking and inhumane of all inequalities, that's really our obligation. And I know that as chair of our Patient Safety and Quality of Care Committee, you hold us accountable to that, and we appreciate that accountability because it is a privilege caring for those patients, as it is a privilege to have you as part of our HCA physician community. And so let me, on behalf of all of our physicians and other caregivers, thank you very much for that. And I know you join me in thanking all of them for heroic service, particularly during this era of COVID.
I do, John, and salute and kudos, high five to all the outstanding HCA physicians and PAs, nurse practitioners, respiratory therapists, patient support personnel who did a tremendous job over the last year and a half. This is why we go into healthcare, and I tell young people all the time, doing anything in healthcare is a wonderful way to live your life and make a life. And I think every day our colleagues across the HCA family do that with distinction. So I'm honored to work with you. There's great company, and to continue the march towards excellence. Perfection is unattainable, John, but the pursuit of excellence in patient care and community engagement and health equity is something we should pursue with vigor.
And that's a perfect note on which to end. Thank you so much, Dr. Wayne Riley, for joining us today.
Thank you, Dr. Perlin.